Hi, my name is Kathy Cummings. I'm the Executive Director of the International Alliance of ALS M&D Associations, and I'm here to talk to you today about the PALS view on multidisciplinary care. The presentation today is based on two things. It's based on a survey that we did in September of people around the globe living with ALS M&D, and we had a companion survey for caregivers of people living with ALS M&D. These two surveys were based on two documents that are core to the International Alliance, and those are the fundamental rights of people living with ALS M&D and the fundamental rights of caregivers. Each year, these rights are updated. They were originally conceived in the late 1990s, and each year our PALS and CALS Advisory Council, who we affectionately call the PCAC, updates those particular documents. In February of this year, they began the work to do that, and they split out the caregivers from the fundamental rights of people living with ALS. They were previously melded together. So when those documents were updated in April of this year, they were finalized in April of this year, we decided to do a survey to see how we were doing around the globe with respect to those rights as stated by the International Alliance. We know that the rights are aspirational, that not all jurisdictions around the world receive the same access to healthcare, to treatments, to the other fundamental rights that are in the statement. But as the Alliance that represents the entire globe, we want to be aspirational. We want to set the bar high, and we hope that many jurisdictions will move towards affirming these rights in the future. So what are the fundamental rights of people living with ALS M&D? They start with the right to the access to the highest quality care available within their healthcare system. And this is the one we're going to drill down on a bit today with respect to multidisciplinary care. We also expect the highest quality treatments available within the healthcare system, information and education, choice with respect to health and support workers, the location where care takes place, and the type of treatment and support that's provided. People living with ALS M&D also have the right to end-of-life choices. They have the right to provide input into their healthcare system on public policy and advocacy. They have the right to the best quality of life possible. They have the right to live without discrimination. And they have the right to confidentiality and privacy of their personal information. They have the right to remuneration. And they have the right, upon diagnosis, to access genetic counseling and testing and to safeguard themselves against genetic discrimination. So those are the fundamental rights. And as I said, we did a survey in September. We received just over 400 responses, 410 from people living with ALS and a further 400 plus from caregivers of people living with ALS M&D. And we received those results from 32 different countries. The survey was translated into 10 different languages, so people would feel comfortable answering in their own language. And this is a summary of the results of that survey. And I'm not going to go into each one of these, but I do want to just note a couple of overall trends that are important around the world. So first of all, the results aren't great at a global level. None of the rights were at 100%, obviously. We didn't expect that they would land at 100%. The highest right in terms of respect for that particular right was confidentiality and privacy. And this makes sense in the era of technology. We have a lot of very robust privacy and confidentiality laws like GDPR and other jurisdictions around the world that try to protect people's privacy and confidentiality. And so not surprisingly, this one came in strong. But look at the top two, for example. The right to the highest quality care and the right to the highest quality treatment. Neither of those even reached 50% at a global level, which I was frankly a little shocked by. So there's room for improvement around the globe in terms of the right to the highest quality care and the right to the highest quality treatment. I also, before I move off this slide, want to draw your attention to that vertical blue bar that is on the screen. That blue bar is the median, which came in at 45%. Again, not a stellar response for being able to respect the fundamental rights of people living with ALS and MND. I want to talk to you a little bit about how we looked at these results and how they relate to multidisciplinary care. So when I explained the rights to you a minute ago, I said that people living with ALS MND had the right to the highest quality care, the highest quality of life, the highest quality treatments, and so on. And you might have thought to yourself, well, that's somebody's opinion, whether they have access to the highest quality care or not. And we wanted to know those opinions. We did want to know if they agreed or disagreed, whether they had access to the highest quality healthcare. But we also wanted to delve into that a little deeper. So we asked ourselves, what does it mean to have the highest quality healthcare? What does it mean to have access to the highest quality treatments? And so we did some sub-questions around each of the rights to see if people's opinions matched what we thought lined up in terms of what was exemplary for healthcare and what was exemplary for treatments and so on. So you can see on the slide on the left-hand side here that, or the left-hand side for me, I'm not sure which side it will be for you, that we asked further questions. So around the quality of care, we asked about multidisciplinary clinics. We asked who people receive care from. We asked about which kinds of supports they receive. And I'm not going to talk about treatments a lot, but we asked things to support that particular right around, do people have access to riluzole? Do people have access to edaravone? And do they have access to clinical trials? Before I jump into how this matrix analysis shaped up, I want to talk just specifically about the question around multidisciplinary clinics. So we did ask people, do you have access to a multidisciplinary clinic? And again, the result was a little shy of 50%. Only 46% of people surveyed who fell into the category of a person living with ALS or MND had access to a multidisciplinary clinic. So how can we change this around the globe? How can we get more access to multidisciplinary clinics? Because we know that they are very helpful to people. They improve their quality of life over a longer period of time. But there's a lot of factors to consider in terms of access to a multidisciplinary clinic. And we know that access is not universal, that distance makes a difference, cost makes a difference, and also just knowing about multidisciplinary clinics makes a difference. Even in countries like my own in Canada, where we have many multidisciplinary clinics, there is a rural and urban divide. So it's not just about one country versus another country, it can be about areas within countries as well. So this slide is the beginning of the explanation of that matrix I described, which is we asked people if they agreed or disagreed that they had access to the highest quality healthcare for someone living with ALS MND. And for those that agreed, you can see down the right-hand side, the people that agreed strongly had access to a multidisciplinary clinic, a specialist dealing in a specialist neurologist dealing in ALS MND, physiotherapist, respiratory therapist, OT, and so on down the line. You will see that the results for genetic counselors is quite low. This is not surprising. Genetic counseling and genetic testing is not universal at this point. So it scored low in all different categories, not just this one. There is a strong correlation between having access to a multidisciplinary clinic and agreeing that you do have access to the best healthcare. There's also a strong correlation between the types of supports that are received within that multidisciplinary clinic. We wanted to take a the supports away from the professionals in terms of, we wanted to make sure that language wasn't influencing the answer. So in some places where a physical therapist might give support in one area or an occupational therapist might give support in an overlapping area, we wanted to make sure we weren't just asking about the professions, but the actual type of support people were receiving. And again, for those that agreed that they received the highest quality health care, they received strong support around medication, mobility, around physical exercise, communication, and so on. So these types of supports became important to people feeling like they had access to the best possible health care. This slide, you have to just change your perspective a little bit. This slide, we asked people if they had access to an ALS or MND association in their jurisdiction. And 82% of people who agreed that they had access to the highest quality healthcare did have access to an ALS MND association. This was a particularly important finding for the Alliance. We are an organization of organizations, and I don't think it can be overstated enough that the supports that our associations provide on a local level to people living with MND and ALS go a long way to people feeling like they have access to the best quality healthcare. So support groups, loan pools, many, many, many different types of supports that our associations offer make a big difference to people living with ALS, MND. So in terms of looking at that relationship between the highest quality of care and what drives it, the respondents who strongly agreed with having access to the highest quality care often were represented in higher proportions in the categories where they said that they received care from a social worker, where they had access to a multidisciplinary clinic, as we just saw, and that they receive care from a nurse who specializes in ALS MND, and they receive support near diagnosis for voice banking, and they receive care from an occupational therapist. So I hope many of you will see yourselves in this slide in terms of being allied health professionals that make a difference to people living with ALS MND around the globe. Many of you have seen charts like this, and you probably have charts like this in your clinics, in your associations, and so on. This one we borrowed from ACELA, which is our Colombian association. It's written in Spanish, and I have zero Spanish, but this diagram wasn't here for everyone to read the words. It was to show the concept of the patient at the center and surrounded by all of the different professions and the different supports that we described earlier in the charts. And also the association is on the outer circle there. ACELA is listed. We would like to see charts like this updated a little bit to include a couple of different things. We would like to see all those professions around the inner circle just like they were on the chart before, but we want to see both the person living with ALS and the caregiver in the center. We know from the companion survey that we did with the caregivers that caregivers are feeling like they don't have a voice, that they're not well supported, even less so than the people living with ALS. And we know that there's a correlation between the quality of life and the quality of care for the person living with ALS with how well supported their caregiver is. So that's one thing that we would wish to see, is that both are in the center of the chart. And also that there's a balance between the physical health professionals and the mental health professionals. There was a strong correlation when we dug into the data about feeling supported and feeling cared for was strongly related to the mental health professionals. So we wanted to make sure that those were well illustrated on the chart. We didn't want to put all the professions on the chart because it would have been too text heavy and difficult to read, but those are a couple of things that we'd like to see updated in the future. So thank you for listening to the presentation today, and also thank you to each and every one of the allied health professionals that are on this. The data that we saw from the survey strongly supports that allied health professionals make a huge difference in the lives of people living with ALS, MND, and the care that they receive, the health care that they receive around the globe. So thank you for everything that you do.
So Kathy, thanks. Absolutely fascinating project. And I think it's always really heartwarming when you can demonstrate the impact of multidisciplinary care. Just a question that I have is, without naming names or anything, were you able to drill down into those areas or specific areas that may need more help and support to kind of bring up the standards of care?
Absolutely, and I think you're asking about specific countries or regions, and we'll be doing a webinar later in the year. This piece that we just looked at right now is just a very small slice of the data about multidisciplinary care, but we looked at each one of the rights, and we looked at them across, as we said, we had results from 32 different countries, and not all of them reached what we would call statistical significance, but we had 10 countries that had enough responses that were able to compare those countries against the rest of the globe and see what the results show us. Jess, do you want to add anything to that?
I think that credit to everyone that took part. I think it gave us a lot of key information around how people living with ALS are feeling right now. And yeah, we will be drilling even further to a lot of the questions next year to make sure that it was a learning experience, and there's a lot of questions that came out from the survey. So we're definitely looking forward to digging in further and learning more about everything that was brought up.
That's the issue, isn't it? When you start asking questions, you kind of end up having more questions than you're answering. So that's really challenging. And I think just to remember that the Alliance, many years ago, I mean, you have been doing this work consistently for years, because 15 years ago, you funded myself and a colleague, Jan Clark, to go and work with the nurses in Istanbul, and they were able to kind of, we worked a lot with them with the funding from the Alliance, and kind of starting to enable them to thinking about care in a proactive way rather than kind of as it happened, but thinking and planning ahead. We did a lot of work that supported by the Alliance. And I think the other thing that makes me think is not only the multidisciplinary team, but it's the timing of the care, isn't it, that has a big impact. And how do we, everybody's different. It's kind of like a constant juggling act. And how can we help with that?
Mm-hmm. I noticed one of the notes in the chat from Sandy said that she would also love to see more balance between mental health and physical health. And that was certainly one of the clear outcomes from this survey, was that the mental health professions around psychologists and social workers made a big difference to people feeling like they were supported and that they had a voice and that they had access to the highest quality health care.
No, I think that another comment in the questions and answers were, is it possible to get a copy of this this information that you have? It's really, really valuable. And yes. Where will you publish that?
That's an excellent question. The survey finished at the beginning of October, the end of September, the beginning of October. So we're really just starting to dig into the data. So we'll do a publication, a report at the time that we do the webinar in the new year. We've done 4 different presentations throughout the Alliance meeting and the Allied Professional Forums, just to do little slices of the data across the different areas that we found some significant findings in. And Jess has one more small presentation that's coming in the caregiving panel later today for the data that we found out about caregivers. So we will publish it in the new year in a report form. But for right now, we're just releasing these kind of global snippets, if you will.
Fantastic. I just really want to thank you both for such a colossal piece of work. I think it's absolutely fascinating, and hopefully will be able to guide us for the future. But thank you so much for your presentation. Jess, there's a lot of questions and comments, I mean, not questions, but comments in the chat box, and I wonder if you'll be able to continue to answer them as the time goes by.
Yes, we'll do, definitely.
Jess and Kathy, thank you so much for your presentation. It's really, really interesting. It's brilliant. Thank you.